Hello, and thank you for joining our webinar on mental health and substance use during the pandemic. My name is Andrew Enns. I'm an executive vice president with Leger and manage Leger's office in Winnipeg. I'll be moderating today's event and very shortly introducing or asking our panelists to introduce themselves. But before I do, I just have a couple of quick technical administrative points that I want to share with you, and then we'll get right into it. First of all, you're all on listen-only mode. You've been muted, but that's not to say that you can't engage with us in terms of asking questions. There's a question box in the there should be a panel on your right hand side of your screen that's got a question menu that you can click on, and it'll open up a box where you can submit a question. So please feel free to do so, and we'll do our utmost to get back to get those questions during our time together. And if not, we can look at them after and try to follow up. There is a chat function. That's not the place for questions, but if you want to insert a comment there, that's for everybody to see. So it's a slightly different format. And while we thank those of you who have attended in live, I do know probably some couldn't, and as a result, we will be sending everybody who registered for today's webinar an email when the webinar is done, and it'll have a link to a recording of everything that we discuss and show you today, so you can review anything that you might want to, and as well you can share this link to the recording with others if you think they might have been interested in it. So again, do thank you for joining us. Now I'd like you to meet our distinguished panelists who will lead us through this important topic in our conversation today. I'm going to start with Michelle Rodrigue with the Mental Health Commission of Canada. Michelle, can you provide us just a short word on who you are and what you do with the MHCC?
Certainly, thank you, Andrew. Good afternoon, everyone. My name is Michelle Rodrigue. I have the honor and privilege of having been recently named the President and CEO of the Mental Health Commission of Canada. I've been fortunate to work with the Commission to improve the lives of Canadians over the last 6 years. So I'm pleased to join the panel this afternoon.
Thanks, Michelle. Robert, I'll ask you to do likewise in terms of what you, sort of your background and what you do at the Canadian Centre of Substance Use and Addiction.
Sure, thank you, Andrew. Good morning or good afternoon, everyone. My name is Robert Gabries, and I am a research and policy analyst at the Canadian Centre on Substance Use and Addiction, CCSA. Ordinarily, I work on several projects related to cannabis, but when I was made aware about this important project going on between the three organizations, I jumped on the opportunity because I have a background in stress, coping, and mental health research. So thank you for having us on the panel. Excellent.
Thanks, Robert. And lastly, I'll call upon Llisa Morrow, who is a colleague of mine at Leger and who is a principal behind this research undertaking. Llisa, a little in terms of who you are and or maybe a little bit what you've been up to with this project.
Yeah, absolutely. Thank you. Thank you, Andrew. My name is Llisa Morrow, and I'm a Senior Research Director with Leger, and I've had the privilege of working with CCSA and MHCC over the last several months on the mental health and substance use during COVID-19 research study. So I'm really excited to share this brief presentation with you that we're going to take a look at today. That'll give you some insight onto what we've been doing.
Excellent. Thank you, Llisa, and thank you. Thank you all. Llisa, I'm gonna leave the floor to you. Basically, Llisa is going to introduce walk us through a few slides, show us a little bit of some of the results from the research, and then we'll pick up our conversation from there. Llisa, take it away.
Yeah. Excellent. Thank you so much. So to start out, I'd like to provide a bit of background. From the start of the pandemic and now to the beginning of the vaccination, the world around us has been changing rapidly, and many have faced economic hardships and the trauma related to losing loved ones during the pandemic, all of which are expected to change the mental health and substance use patterns among Canadians. MHCC and CCSA, in partnership with Llisa, are tracking the relationship between mental health and substance use over time and across groups. In October and November of 2020, the baseline survey was completed. Using a tracking approach for the data collection, a survey of Canadians was completed every 2 months. Each time period builds on the results of the baseline survey and will add to the mental health and substance use trends developing over time. This presentation includes a cross-sectional finding collected over 4 time periods, starting in October of 2020 to March of this year. Throughout the presentation, you will see we refer to each time period of data collected as T1, T2, T3, and T4. The findings of this research will be used to understand the ongoing impact of COVID-19, tracking its relationship with mental health and substance use. And just on an important note, before we do begin and get into the presentation, our presentation does contain mention of suicide as well as legal and illegal substances. So let's first take a quick look at the methodological approach used for this study. So the study population consists of Canadians 16 years of age and up. The data was collected via an online survey using Llisa's online panel, LEO. The survey data was collected over 4 time periods. T1 is the baseline survey with a sample size of 2,500, completed in October and November of 2020. Additional data collection was completed in November and December of 2020, January of 2021, and March of 2021, each with a sample size of 1,500. In total, just over 7,000 individual surveys have been completed. Today, we'll be taking a closer look at 4 of the priority populations identified in the research: individuals living with mental health diagnosis, individuals with a lifetime substance use diagnosis, and individuals reporting current problematic substance use, and individuals reporting current mental health symptoms. It's important to note that the sample size for individuals that are in the lifetime substance use priority population is limited, so we will need to approach those findings with caution. So just a quick overview of the slide structure that we'll be looking at. Each grouping of bars represents a specific population. The general population is anchored on my left. Priority populations on this slide include those diagnosed with lifetime mental health disorders, lifetime substance use disorder, and current substance use. And we're looking at the data by population group across time. The green bar is the most recent data that we collected in March, and the one that I'll be referencing most today. So most recently, in March data collection, 15% of the general population reported moderately severe to severe depression symptoms. According to the Canadian Community Health Survey, 2% of Canadians reported moderately severe to severe symptoms of depression in 2015 and 16. While we cannot make a direct comparison to these 2 studies, it does provide us with some idea of how reporting of depression symptoms is changing. Additionally, our data indicates a lifetime mental health diagnosis and substance use concerns, particularly current problematic substance use, are more likely to report severe depression symptoms. We also know that a higher proportion of single-person households, households with children, and women are reporting moderate and severe depression symptoms. According to Stats Canada, 3% of Canadians in 2019 reported seriously contemplating suicide in the past 12 months. As we can see, the research results show that 7% of the population has experienced suicidal ideation since the beginning of the pandemic, this percentage being significantly greater within the priority populations. The data also indicates that 10% of single-person households, a significantly higher percentage compared to the rest of the population, report seriously contemplating suicide since the beginning of the pandemic. During the most recent polling, 29% of respondents reported using alcohol more often during the pandemic, only slightly down since January. The priority populations, those with mental health and substance use concerns, report significantly higher amounts of increased alcohol consumption during the pandemic. Single-person households, households with children, and women are also more likely to report increased alcohol use as well. We also know from findings that a higher percentage of males and single-person households are more likely to report problematic alcohol use compared to the rest of the population. Taking a look at respondents who report using cannabis, 31% report an increase in their consumption during the pandemic. This percentage is significantly higher among the priority populations, including those who report current mental health symptoms, lifetime substance use diagnosis, and current substance use. This slide maps out the top mentions of COVID-related stress reported by the general population. Now, as we look at the data across time, we see concerns regarding finances and social isolation are growing. We see a 2-point jump in those who indicated that social isolation is a major stressor during the pandemic, 14% in January and 16% in March. Perhaps not surprisingly, individuals from single-person households are more likely to report that social isolation is the main stressor for them during the pandemic. With increased mental health and substance use concerns comes the increased need for support services. 12% of respondents and 18% of current mental health respondents reported accessing mental health treatment in February and March of 2021. And we know that 1 in 5 people who access treatment for services for mental health found this access to treatment difficult. Six 6% of all respondents and 20% with current problematic substance use report accessing substance use treatment in February and March of 2021. In addition, 1 in 4 people who access treatment services for substance use found access difficult. So what are the next steps? Well, in addition to the research the data that's already been collected, an additional 3 waves of data collection will take place in May, July, and September of this year. The next full report for the T1 to T4 time periods will be released early May, and this report will have a closer look at some different priority populations, including gender differences, single-person households, and households with children under the age of 13. Upon completion of the collection of data in September, we anticipate having a large enough data set that will allow for a more detailed examination of additional priority populations, including the LGBTQ2+ community, lower income, youth, and seniors. And once all data collection is finished, we will have just under 12,000 surveys that will have been completed. So we know that those living with mental health and substance use are experiencing symptoms of depression, anxiety, and increased substance use risk at a disproportional rate in comparison to the general population. This is also the case for single-person households, households with children, and women. So I know that we're excited to hear from our speakers today, so I will end the presentation with this one final slide. If you or anyone you know needs access to supports or resources, please do take note of this slide. Please also check on those around you. this is really an important time for us to continually be supportive to one another. Thank you.
Excellent. Thanks, Llisa, for that. I mean, I know there's a lot of data, and sometimes the hardest part is to try to sort through and try to pull together, enough to make a good narrative. And I think you did that. I just found it so interesting in terms of our start and point where we are today is really that. If you think back to the second wave of this pandemic, the one that really sort of took hold is when we started our work, and now here we are. Depending on where you live, in the teeth of a third wave, and you really see some of that track in those timelines. I thought that was really fascinating. I'd like to hear now from our panelists. And Michelle, I'm going to start with you in terms of like you come at this from a very deliberate and a very learned perspective. I mean, what do you take away from from this research to date? From your organization's view.
Thank you, Andrew, and thank you, Llisa. A great overview of a lot of material. I think it's, kudos to you for that. I'd like to start by thanking you for inviting me to participate today. I think the value of the Commission's close relationship with CCSA has really been underscored by this polling. And we are very fortunate to be able to have another partner like Llisa to work with us on this. I think that throughout this pandemic, it has become increasingly clear that people are experiencing poorer mental health and turning to substance use more often. While overall this is troubling, it's not terribly surprising when you consider that the combination of social isolation, financial hardship, stress, and the sheer uncertainty that we have all experienced over the last 14 months. What struck me the most from these findings, however, was the disproportionate impact on those who were already living with a mental illness or problematic substance use before the pandemic. I mean, think about this. It's hard not to feel disheartened to learn that 15% of the general population are reporting moderate to severe depression. But to see that number more than double among participants with a history of mental illness and problematic substance use is really a difficult metric to absorb and to wrap your mind around. Likewise, when we review the data sets around thoughts of suicide, where the results really paint a grim picture of the prevalence with which individuals who are already living with a mental illness or substance use have contemplated taking their lives. So for me, one of the biggest takeaways from these results is the need to ensure that as a society, we address the full spectrum of need. There's been a significant and encouraging effort to mitigate the impact on the mental health of Canadians throughout this pandemic, particularly those with mild to moderate symptoms of mental health or concerns with substance use. The Wellness Together Canada platform is an excellent example of that. But as the polling makes clear, we must not forget those who have already and were already experiencing mental health and substance use challenges. There was a need for expanded services for mental health and substance use services long before the pandemic, so we weren't meeting the needs. And as the results show, that pocket of need has only grown deeper. As we continue to learn through our partnership with CCSA and Llisa, there's an inseparable link between mental health and substance use that cannot be denied and really must not be ignored. So as these findings, they reinforce the work or the importance of working together to find the most holistic solutions to ensure that no one, and I really mean no one, is left behind. So thank you for that, Andrew.
Terrific. Thanks, Michelle, for those insights. Robert, there were some numbers there with respect to the substance use, and as Michelle said, I mean, I guess we're not surprised, but You've been at this for a while in this space. I mean, what jumped out at you when you've been looking at these numbers?
Yeah, I think as Michelle mentioned, it's not entirely surprising. I think that a lot of researchers ahead of time knew that chronic stress and trauma, like that of the pandemic, does increase the risk of substance use and increases the risk of mental health and substance use disorders. So I think a lot of us already knew that. And we also knew that people who have pre-existing mental health and substance use conditions would probably be at greater risk relative to the rest of the population during the pandemic. So I think that those sort of parts we already knew, but I think what was sort of especially interesting about the data is to see it across all of the outcomes, regardless of how we looked at the data. And I've been intimately involved with this project with Llisa, with the Léger team, and with MHCC, and we analyze the data a variety of different ways. And every single time, regardless of how we analyze the data, it was always the same findings, that substance use and mental health are connected. So I think that's an important message that we need to put out there to everybody to know that there are a variety of different populations at risk during the pandemic, and not everyone is being equally impacted. And with the findings that we see here, we see that individuals with pre-existing mental health and substance use are being more impacted than other groups, for sure.
Excellent. Thanks, Robert. I want to stay with you two, and maybe bring a little more precision, I guess, to some of your comments with respect to the government. I know a number of policymakers, some decision makers with governments have registered and potentially are on right now. The pandemic has presented, I think, like in our living memory, the greatest challenge to government in terms of the management of this, and quite frankly, the focus has been on the physical health of Canadians and our neighbors. It's shifted to now a race to get vaccinated, and we're bombarded with information, and governments are stressed to get that done, the rollout, get vaccines. I'm not saying they don't know of the mental health problem. It's been a constant sort of background, but I do fear that when we hit that mission accomplished on 70 or 80% of vaccines, that there is going to be still a big problem as a result of this pandemic. And I guess I turn to you, Michelle, first. If you can give some advice or some counsel to policymakers as they approach this, what do they need to start thinking about?
Thank you for that. A core question to our issue today, and a core question that we need to address. So these results really highlight the need to keep mental health and substance use at the forefront of any response to the pandemic. And let's be clear, the impacts on people's wellness, so mental health or mental health problems, and problematic substance use are going to be delayed, they're going to be complex, and they're going to be long-lasting. So we need to strengthen equitable access to quality care when and where people need that. We know that long before the pandemic, it was 1.6 million people in Canada who were not able to access the mental health services that they need. 1.6 million. Since COVID-19, that demand for services has only increased, but the offering really has not been able to keep up. As we've seen, the consequence of that care gap has been felt the hardest by those who entered the pandemic with a history of mental health problems and substance use problems. And let's put that in context. Consider that by the age of 40, so age of 40, 1 out of every 2, I'll repeat it, 1 out of every 2 people will have had a mental health and substance use problem. Chances are, all of us have colleagues, friends, family members, loved ones who have experienced these problems, and it's those individuals, those people who are close to us, whose mental health has been disproportionately affected by this pandemic. So what can we do to close the gap? It will need and will require ongoing investment in mental health and substance use, including how we offer services, and we will need to be a lot more deliberate about the way we use virtual care. If you remember, the final word is we've used pivot quite a bit, and we've pivoted to virtual care. So telephone or video consultations, but we weren't really prepared for that. So that means we also need to invest in high quality e-mental health services, which have the ability to drastically reduce wait times and overcome geographic barriers, assuming people have enough bandwidth to have access to internet. E-mental health models that access tools to offer the appropriate level of care. So increasing the level of care when people need them, reducing the level of care when people need them. So it adapts to your changing needs, are a successful example of this. And I'm proud to say they have become the foundation of the Wellness Together Canada portal. While I don't purport this to be a panacea, developing and expanding e-mental health technology is a promising step forward towards narrowing that care gap.
Great.
Along those same lines, I was really encouraged by the investments proposed by the federal budget in extending Wellness Together Canada, and we'll have an opportunity, I hope, to speak a bit more about that. But Wellness Together Canada portal is somewhere where Canadians can access services in French and English. They can get self-evaluated. They can have tools and guides to help them remain healthy, to help recovery. And if their needs are higher, they can have a telephone consultation. So those are important elements. And I think the other important investment is in a 3-digit suicide prevention crisis line, something that has been required in Canada for many years. So going forward, policies that also support the social determinants of health will be essential. So making sure people have enough income to support their needs, investing in affordable housing, childcare relief, like that we've seen in the most recent budget. I think we shouldn't underestimate the ripple effect of initiatives like childcare support, which in turn help the droves of women who have been sidelined from the workforce because of COVID-19, and that will really help reduce the impact on their mental health of the pandemic. So at the end of the day, as Llisa said, we have all been affected by COVID-19 in some way, but this polling makes it clear we haven't all been affected in the same way. Our collective success will depend on having partners working together to improve access to mental health and substance use services for everyone. So thank you for that.
Yeah, excellent. Yeah, and as you touch on it, you know, you got to remind ourselves that there's the direct programs that can address mental health, but it's some of these other programs that you don't necessarily equate, like childcare. I think is an important, that these all are important. In fact, probably necessary activities to sort of collectively get at this. Robert, is it from your perspective? I'd like you to provide some counsel advice to our government friends who might be listening in.
I mean, exactly as Michelle noted, we definitely need to invest more in mental health and substance use. I think that's right off the bat, that is one of the most important things that we could do, especially among individuals who have been disproportionately impacted by the pandemic, and also those who have traditionally been underserved within this area. So I'm also happy to see that the federal government is proposing to invest quite a lot of money in terms of support for mental health and substance use across a variety of different populations, and it will be interesting to see how that unfolds over time. But one point that Michelle made that I think is actually even more important is addressing some of these social determinants of health that we know are contributing to mental health and substance use disorders. So along the lines of income equality, differences between sex and gender across a lot of services, and childcare is an important one. Systemic racism is another big issue that's shown up within the federal budget. So I think not only addressing mental health and substance use from a treatment perspective, but also from a prevention. And I think while the prevention area is a little bit harder to achieve and it's more of a long-term goal, I think it's way more impactful than dealing with these sort of conditions once they've already appeared. And within the context of quality of care, I know that there's a lot of work going on within this area, especially with co-occurring disorders, so concurrent disorders, where we know that a large proportion of individuals who seek treatment for addiction, for example, also have an underlying mental health condition. And traditionally, addictions and mental health have been treated separately in isolation of one another, which is sort of counterintuitive because one condition influences the other. So I think making more progress within this area will be important moving forward. And the CCSA and MHCC are actually working with a variety of stakeholders in developing best practices in the treatment of concurrent disorders. So I think that is another important area that we need to address. I know that we're presenting data, or we show data that access to treatment isn't necessarily keeping up with the amount of people who are reporting symptoms of depression and anxiety and problematic substance use. And Michelle and I have talked about this actually right before the webinar. Is stigma is a big component of this. I think we need to do a lot of work within this area, is addressing stigma for mental health and for substance use, as we know very well that this is one of the main barriers for people accessing treatment for a variety of reasons. And a final point I do want to make is around virtual care. I agree. I've been reading the news lately, and it's been showing across a variety of different organizations that the wait list to seek treatment, to see a psychologist or a psychiatrist, are incredibly long, and it's really difficult for people to see these healthcare professionals. So in order to be able to make sure everyone has access to some sort of treatment, increasing capacity in virtual care is an important step that we need to move forward with.
Great. Robert, on that point, I'm curious. I always, is that a bit of maybe a little silver lining out of the pandemic? Is that it's forced us, not just on the substance use or the mental health, but just generally in terms of healthcare and whether it's prescription renewals, to really change how we maybe approach that and force some of the regulatory bodies that move a bit slow and governments who don't see these as priorities in terms of virtual, allowing virtual care or creating the billing systems to accommodate that kind of meeting versus an in-person. And I would imagine that out of this, we may have the opportunity to dramatically rethink and hopefully, as you've pointed out, potentially maybe increase that access for people and shorten those wait lists. Would you see that as maybe an outcome of the pandemic?
Yes, certainly. I think the pandemic has sort of shined a spotlight on a number of weak links within our healthcare system and other systems within Canada. And mental health and substance use treatment is certainly one of them. Traditionally, as Michelle pointed out, these mental health and substance use has been underfunded relative to other systems within Canada, and it's really encouraging to see that that this has become a focus within the federal budget. And if there is anything positive about the pandemic, is it's shined a spotlight on mental health and substance use, and now we're focusing more within this area, not only in terms of funding, but also within community supports and being more open about talking about depression, anxiety, problematic alcohol or cannabis use. So I think there aren't very many positives about the pandemic, but certainly being able to draw attention to something that has typically hasn't had much attention to it is good. And I think on the lines of how you mentioned virtual care, we were already in the progress. I think Canada was already in the progress of sort of moving towards virtual care because there was already a need for that. And the pandemic has certainly sped that up because at times with lockdowns and restrictions, it wasn't very easy to access any of these treatments in person.
Yeah. Michelle, did you want to add anything to Robert's comments there?
Just to build on Robert's analysis, I'm not sure I would talk about silver lining, but certainly a reality is the scope and depth of the pandemic and its impact has forced systems to move rather rapidly. And I think public servants at Health Canada should be commended. They were able to really move quickly and put in place Wellness Canada portal so that people had access to virtual care in a very rapidly way. For context, we have been talking about this for 10 years. It took 6 to 8 weeks to get it done in the context of a pandemic. So you are right. It has challenged us as a society. It continues to challenge us individually, but we should be proud as Canadians that we were able to collectively turn around and pivot and offer services that were really deeply required.
Excellent. I want to turn to a topic in terms of the connection of that mental health and substance use. I mean, I think this partnership that your two organizations have embarked on is terrific. And I don't know if it's the first of its kind in Canada or not, but I think it's almost to me it's almost a natural. And I'll be honest, I'm a layperson in terms of on this stuff to that degree, but I just from what you hear and feel, I think it is such a natural fit and so much learning to be done by looking at the problems together. And I'm just again, why is there this connection in terms of this mental health and the substance use and how we see it amplified by the pandemic, but clearly it was something that was pre-pandemic as well. I mean, is there something around this that you can articulate a little bit for us? And maybe I'll start with you, Michelle, in terms of why there seems to be they go hand in hand a little bit.
Sure. I mean, Robert is really an expert in this space, so I'll kick it off and turn things over to him. It often happens that someone with a mental health problem will have associated with that problematic substance use. And the same is true vice versa. So, but because of stigma, as Robert raised earlier, because of prejudice, we have built systems of care that are separate track. So we're asking individuals who are already struggling and at the point where they have the courage, the strength to come forward and say, I need help, we're imposing on them a service or systems where they're not able to access the full scope of service that they need. So that's why for me, I'm also very involved, an advocate in the space, but don't purport to be an expert. It makes sense. It's just common sense that we should make the pathway for individuals as simple as possible and really work towards their recovery. Robert will have a much more learned perspective on that.
No, that was an excellent answer, Michelle. And just to even expand on that, I think, so my background is in stress, mental health, and substance use. So I'm going to give a little bit of like a neuroscience-y answer to this. And the risk factors for both mental health and substance use are the same. And one of them being early life experiences. that sort of shape the way your brain molds essentially over time, and those sort of experiences put you at risk of both conditions like depression and anxiety. And if you're exposed to certain substances like cannabis or alcohol, you might be at risk of developing a problematic substance use related to that. So I think I think the risk factors for both conditions are very similar, and a lot of them are to do with early life experiences, but also more proximal events like socioeconomic status. We know that that's a very strong predictor of a variety of mental health and substance use conditions, and even health conditions in general. So I think that's sort of how I would answer that question. And for those interested, we actually are doing a lot of work in this area. We call it the Brain Story, or the Brain Builders Lab, and you could check that out on our website. And it also appears on the MHCC website. So it sort of goes through how early life adversity and chronic stress sort of impact the brain, and how changes in the brain sort of put an individual at risk of both mental health and substance use disorders.
Excellent. I'm picking up a few questions here from our listeners, and another one that's come through, and it touches on some of those pretty stark numbers in terms of the pandemic's impact on, well, actually on depression in particular, but even on some of the substance use numbers that we see. And you know, one of the questions was, so when the pandemic's done and we can go back to kind of maybe life, or maybe a little more normal life, you know, do we feel, and Michelle, you can jump this off maybe, or the sense that we'll go back to more normal kind of levels of depression in the incidence in the general population, or is that maybe kind of wishful thinking?
Well, that's a great question. Look, over the upcoming months, we'll live through another series of important changes. Hopefully, we will almost all get vaccinated. And will that lead to improved mental health? We'll need to wait and see, and we'll be really paying attention to that. Will at least some of the populations who have indicated to us that they're experiencing symptoms of depression and anxiety, often in tandem with increased substance use, show some sign of relief. So as we look forward, it will be important, I think, from my perspective, to learn which other groups have been disproportionately affected by the pandemic. And as we've seen so far, we know that those who have a history of mental health and substance use problems have been affected largely more than the general population. We alluded, or Llisa mentioned this at the end of our presentation, but we really need to dive much deeper into and to better understand the impact on women. For instance, those who are also taking care of children at home, balancing work at the same time, as well as dealing with all the stresses of this pandemic. We also must learn a lot more about the effects of the pandemic on youth. We have seen a number of surveys demonstrate or point to alarming statistics in terms of declining levels of wellness among our youth. The isolation is really impacting their mental health. The same for LGBTQ2+ and low-income populations, all of whom, we must note it, have unique challenges well before the pandemic, and really we can't overlook their needs at this exceptional time. So overall, the better we understand and identify areas of greatest need, the more effective we will need to develop solutions to address them. And the pandemic has underscored the importance of investing in initiatives that address the growing demand for mental health and substance use services. The two are really connected, and you can't disconnect the two. And I think that's one of the major takeaways from this polling. So as we seek answers to the many outstanding questions before us, I'm really grateful for this polling initiative and for the partnership with CCSA and Léger as we try to shed light on the path forward.
Yeah, for sure. Robert, did you want to just add a bit to that?
I agree with Michelle. It's sort of hard to predict how mental health and substance use is going to change over time because there are so many things changing and evolving with the pandemic. On the one hand, we do have an increased number of people who are being vaccinated, which is, of course, very good news. But in Ontario, we're still in a lockdown, and cases have been higher than almost ever before. There's, I guess, a bit of a trend of it going down, and there's concern about new variants. So even it's hard to tell when this pandemic is going to be over, and we're seeing higher rates of depression, anxiety, and substance use right now, and that I don't think is going to change just overnight. Like you can't just snap your finger and all of a sudden everyone's going to be well. And I think people are going to be in a position where once we start opening things up, it's like, what just happened for the past year and a half? Like it's like almost like a blur for some people. So I guess like sort of reflecting on a year of being in a pandemic will affect a lot of people as well. But Michelle mentioned it perfectly. It's really going to depend on the individual. I think some individuals have been hit harder during the pandemic now more than others, and this might affect them moving forward as well. And we know that youth is one particular group that others have looked at, and it's something that we continue to look at as well. We just haven't really put it in any of our open-facing our reports yet, but it is something that we plan on doing. Again, low-income groups, we do plan on coming out with a whole bunch of work within that area, because we know that not only is their mental health being affected, but we know that the pandemic in general is affecting individuals of lower income and lower socioeconomic status. So, and the LGBTQ2+, we're also collecting a lot of data within that area. So we do have a lot of work and a lot of data that we're going to put out there eventually. And I just wanted to remind everybody that we're actually only halfway through this polling initiative. And it's been a pleasure working with MHCC and with Léger throughout this process. And it hasn't necessarily been specific to the pandemic. Like we've all worked really closely together in the past before, and it's just been an easy collaboration to be a part of. And I'm happy that I've been able to work with everyone here.
No, for sure. No, that's a good point. A good point that you raised. You know, I think, and I'm mindful of where we're at in terms of our time together. But I thought sort of be remiss. We've talked a lot about programs and things that government can do and different opportunities. But your two organizations are in addition to sort of doing some of the good research work that you do, you also, I suspect, are involved in terms of some direct support activities yourself. And maybe Rob, I'll ask you to start us off in this one in terms of some of the things that CCSA is doing. And then I think it'd be interesting too to share some things that you've to use the word Michelle as a result of the pandemic that you sort of maybe you've done in particular to address some of those changes brought on by the pandemic.
Sure. I think we have collectively, us and CCSA, collaborated on a number of pieces aimed at Canadians. So I would encourage you to, if you're interested, to visit our website at mentalhealthcommission.ca. CCSA.ca is the other resource. On our resource web, you will find a series of tools that will help you manage anxiety, remain resilient, tip sheets on how to engage in difficult discussions in someone who may be struggling. We aren't giving usually the tools in the toolkit to see if someone's really not well, and you are concerned they may be at risk of harming themselves. How do you engage a discussion about suicide? We have tips about that. So please do. Also encourage people to visit if they're not feeling well, if they're not feeling themselves today. The Wellness Together Canada portal is a great way to start, or simply access services that are offered locally as well.
Excellent. Robert, anything out of CCSA you wanted to add to that?
No, not much beyond what Michelle mentioned. We do have a whole bunch of resources on both of our websites, and we collaborated on a whole bunch of them as well. So I suggest checking those out. And they're not only specific to COVID. Like, we have a lot of resources that could help people talk about substance use or mental health with others, with youth, and like contacts across Canada for where to look for in terms of how to reach out for help. But I agree. I want to echo what Michelle said. And if you or someone you know isn't feeling well, then it's to reach out to the Wellness Together portal. I think that's an excellent start, and it's an excellent resource for people to take advantage of, for sure.
Excellent, excellent. So one of the last questions that also came up from one of our audiences. A couple of times we've referred to the fact that we're really only at about the halfway point on this research undertaking, and sort of hoping we're beyond the halfway point on this pandemic, but it still presents some challenges in the sort of months ahead, I suspect. I'm curious, I'd like to hear from both of you on this. What will you be looking for? There's been some, we've shed some great insights on some things, but there is a lot of data to collect, and what will be some things that you might be of particular interest in? Start with you, Michelle, from your perspective, your organization's perspective.
We know that we'll call the general population, their mental wellness has declined substantially. So will we be able as a society to offer services that are deeply required for us to be able to look at a recovery? So a social economic recovery from a healthcare perspective, from a mental health perspective, society and economically. So those are our elements we'll be looking at. But particularly around our polling initiative, what's been the impact of this pandemic on youth? I think that's a top of mind issue for all of us. Other populations which may be more at risk, LGBTQ+. There's also women who have been disproportionately affected by the pandemic economically and on the wellness scale. So we need to pay particular attention to that, and we need to track that through the polling. And people who are already suffering in terms of their own wellness, as well as financially prior to the pandemic, what has been their journey and experience throughout this. So I think those are some of the elements that we will be looking for through the polling, and as we hopefully look at coming out of this. I mean, if I look back at March of last year, we thought we were being cautious in sending our teams home for 3 weeks. 3 weeks. We thought we would be cautious, right? We are now 14 months into this, so we're not sure how this will turn out. But at the very least, now that more of us are getting vaccinated, there's some reason to be hopeful.
For sure. Robert, did you want to add to, what I'm curious from your perspective, what will you be looking for as the more data comes in? It's like Christmas every day for CCSA.
No, exactly. As being a researcher, I'm very excited about having the opportunity to work with a lot of this data, and especially because it's real time. It's not something that you look at like old data and all of a sudden you're you're trying to analyze what's happening. It's very, very real time as a pandemic is progressing. So we will continue to look at different populations and make sure that we shine a spotlight on some of the people that are being most affected, so that and we're hoping that in some ways this could inform policies, or at least give a voice for people who are being affected by the pandemic, which normally might not necessarily have a voice within that area. I am very interested to see how this is going to evolve over time. As you mentioned, we're only halfway through the polling, and there is still a lot going on within the pandemic. So it will be interesting to see how mental health and substance use is going to change over time. I think right now we're not really sure. I don't think anyone is really sure, because it seems like the pandemic is literally changing from day to day. So, but we are hopeful that things are going to get better for Canadians over time, and that's something that we do hope on capturing. But one thing that we've been doing a lot too is we're doing a lot of tracking and monitoring of mental health and substance use over time across various priority populations. And one of our next steps is to understand why now. So not only the monitoring component, but also why. So we're going to be looking at different types of stressors and a person's circumstances around why might this person be more or less affected by the pandemic, and what exactly about the pandemic is leading to poor mental health and increased substance use. And it's something that is actually going to come out shortly on May 6th with some of the work that we're looking at in terms of households with kids and single person households. So one of the findings there I'd like to tease a little bit here is the most prevalent stressor for people living alone, which is not surprising, is social isolation. So for that particular group of individuals, that's a very powerful element within the COVID-19 pandemic. Within looking at households with kids, females tend to report as one of the top stressors childcare. So we see that each population is being affected by the pandemic slightly differently, but in the end, the outcomes are almost the same. So that's something that we're sort of looking to moving forward.
Excellent, fascinating stuff. The teaser, I never gave a teaser alert to anybody there, Robert, so that was great.
Yeah, sorry, hopefully I didn't spoil the movie.
Well, look, that kind of, sort of draws our program to an end. I'm mindful we're getting near the top of the hour. I want to thank, Michelle, MHCC, Robert, CCSA, Llisa for putting together and kickstarting this whole conversation. And in addition to, we certainly appreciate the collaboration and the working together with this and the partnership our three organizations have. I also appreciate the willingness for the two of you to participate in this sort of thing. At Leger, since the pandemic, we've made a real effort to share our research and the work that we've done, whether it's on the commercial side, retail, on healthcare. As I think that it's such an extraordinary time that I think as much as we can, we want to share some of the insights and some of the information that we've collected, and I really appreciate you, both your organizations, agreeing to do it and taking the time and making the effort to do it. I think it's terrific. And appreciate it.
Enjoyed it, and look forward to the continuing of this and the results that we will see. And thanks, Robert, for the teaser for next week. Well done.
Well, and maybe we can reconvene in 4 months' time and do an annual or a year wrap up. But so thank you all for attending. I know there was a lot of you attending through the webinar. Much appreciated. But just a reminder: be on the lookout for that email with a link to the recording. Hopefully, you found this informative, and please be well out there, and take care. Goodbye.
Bye. Thank you.